They make them that big?
Yeah, they're big. They're big. They telescope. So, all right. So my name is Dr. Omar Perez, orthopedic surgeon, sports medicine specialist, and today we're gonna talk about Kevin Durant's most recent knee injury. A few weeks ago, he injured his knee when Jimmy Butler landed on the side. Kevin Durant felt a pop, started getting sore. He was able to walk but couldn't continue. He continued to play a little bit but realized he was not doing well, so he was taken out of the game. Later on, they did an MRI and it showed that he has injured his MCL. MCL stands for medial collateral ligament. And he's just coming out of an injury which took 6 weeks to recover. So it seems that another episode re-injured the same ligament. So a medial collateral ligament, what it means is collateral, it's a name for sides. So looking at the knee from the front, this is a right knee. This one right here is the MCL. And then we have the counterpart, which is the lateral collateral ligament, which is the LCL. These two ligaments are different from the ACL, which is a common injured ligament, which is inside the knee joint. So if you look at here, the MCL and the LCL, the two collateral ligaments, are outside of the knee joint, while the ACL is inside of the knee joint. Why is this important? It's important because by this ligament being outside of the knee joint has better blood supply. That means that has a good healing potential without having to operate. Now there's 3 different grades of MCL injury: grade 1, grade 2, grade 3. Grade 1 is the less severe and it's a partial stretch of the ligament. So the way this ligament injures is someone hits you from the side, someone falls on the side while the foot is on the ground. So that impacts, what creates is this side to open up and this side to collapse. So by open up, you can see here how the fibers of the ligament stretch out. So depending on the severity of the trauma, you can have either a stretching, a partial tear, or a complete rupture, which is the ligament detaches completely from the bone. Most of the MCL injuries can heal without surgery. The lower grade injuries take 2 to 4 weeks to heal. The higher grade injuries can take 6 to 8 weeks. The most commonly torn is the part that attaches to the femur. Okay. Now, when it's a more severe injury or it's a detachment from the tibia, those are more troublesome to heal and might need surgery. The treatment for this type of injury, it's technically prevent this movement of the knee while the patient is walking, just to allow the ligament to tighten up and heal and scar down. The way we achieve that, we can put a patient in a long hinge knee brace. By having hinges, it acts as if it's an external ligament and prevents the knee from moving side to side. Patient can do range of motion, they can do bicycle exercises, and then once pain gets better, they can start doing more sports-specific activities. Ultimately, there's some additional treatments that we can do to accelerate the healing. For example, in this setting, we can do what we call a PRP injection, which is a plasma injection. That is a byproduct of the blood. It's a product in which we draw blood from the patient's arm. Then we spin and we extract the layer of healing factors that everybody has on their bloodstream. And that concentrate, we can inject it into the ligament to accelerate the healing. And it's very widely used to decrease the amount of time that the patient stays in the injured list so they can get back into sporting activities. Reading at the report, it seems that it's a re-injury of the previous MCL sprain. They expect for him to be out 2 to 3 weeks, but my best guess is that he will be out longer. Now, Kevin Durant is not as young as he used to. He has been plagued with injury later in his career, so the Nets are doing well. So I don't think there's a need for them to risk him and then he gets re-injured at the end of the season when they are projected to go to the playoffs. So if I was a team doctor, I will just keep him out as long as possible to allow for full recovery and so he can go back on track.
So for him, do you think he's wearing one of those long legs?
He might be.
They make him that big?
Yeah, they're big. They're big. They telescopes. And it depends if he feels unstable or not. If he doesn't feel unstable and it's just pain, they might just put a simple brace and then